At Corewell Health Lakeland, our hospital-based simulation training center is dedicated to delivering the best learning experiences to our organization, community, and partner organizations. We provide simulation-based healthcare education to medical students, residents, physicians, nurses, and allied health professionals in all 3 of our hospitals in our system, as well as the Berrien County Local Community Emergency Medical Response System. The center attained full accreditation from the Society of Simulation in Healthcare in 2023 in teaching and education and systems integration. Accreditation recognizes that the center adheres to the best practices in simulation, allowing for maximal educational benefit of each educational activity that our learners complete. Simulations are conducted in a controlled and psychologically safe environment that serves as a bridge between classroom learning and real-life clinical experience. The Simulation Center develops realistic, evidence-based simulation using different methodologies of simulation-based learning, including high-fidelity, specialized mannequins, task trainers, simulated patients, hybrid simulations, and in situ simulations. SimMan 3G is a high-fidelity interactive simulator that provides learners with a fully immersive simulated experience. Its multiple features allow for simulation of complex medical cases that prepare learners for real-world situations. Megacode Kelly is an advanced life support mannequin that allows for realistic training on a wide variety of advanced life-saving skills with ability for cardiac defibrillation, pacing, and EKG interpretation of multiple rhythm variations. SimMom is an advanced full-body birthing simulator with accurate anatomy and functionality. SimMom gives birth to Birthing Baby, a full-term newborn mannequin, allowing for interprofessional obstetric training of birth management. Sim Junior is an interactive pediatric simulator that simulates a wide variety of conditions from a healthy talking child to an unresponsive critical patient with no vital signs. Sim Junior allows learners to focus on a broad range of pediatric skills in order to gain exposure and practical experience of life-threatening pediatric problems. Sim Baby is a realistic infant simulator that allows providers to recognize and respond to critically ill infants. Newborn Tori is a full-term neonatal simulator that offers high-fidelity neonatal care simulation training. Both are wireless and tetherless, enabling simulated cases to be performed throughout the hospital system. In addition to high-fidelity mannequins, the Simulation Center also has numerous task trainers used for enhancing current procedural skills or gaining new skills in a controlled environment. These task trainers allow for the closest possible experience to treating a real injury or condition and can be incorporated into simulation activities or used as a standalone station.
Here in the simulation lab, I work as the simulation specialist, where I often act as the patient and I kind of control the mannequins and their vitals and anything that they're going through.
I'm having a really hard time catching my breath.
And I speak as the patient, so sometimes it's a woman, sometimes it's a man, and we use voice morphing software in that situation, which makes it extra fun.
Well, what's wrong? What's happening?
My heart is, I don't know, I feel like it's just beating really weird.
We also use cameras to kind of monitor what's going on in the room, so even when I'm not in the room, when I'm here in the control room, I can still see what's going on. In the simulation lab, we do moulage, where we're kind of using makeup to do different wounds on the mannequins or different cuts. We can even do different abrasions or burns.
He's got an abrasion to his left thigh.
It's really important because we're able to kind of bring the learner into a realistic environment. It kind of has them experience it more like they would on a patient.
At Lakeland, we use in situ simulation. This is where you take the simulation scenario and bring it to the live clinical environment. This method is really effective when you want to test protocols and high-stakes procedures.
Can I have a little help here, please? I need some help.
This is also really helpful for us to focus on behavioral teamwork skills and interpersonal communication between teams. This is very important when you want to develop a high-functioning healthcare team.
1 and 2 and 3 and breathe.
Oh, it hurts. Please. Ow.
Just stay down, you're okay.
We're almost there.
Oh my God.
Here at Lakeland Simulation Training Center, we use standardized patients. Standardized patients are live actors that we use to portray patients during our simulations. This is a very effective method to use when you want to focus on interpersonal communication skills and emotional intelligence.
Probably one of my favorite parts of being in the sim lab is I actually get to portray patients once in a while. I might be a stroke patient.
Can you lift up your left leg for me? Can you lift up your right leg? Okay, let's activate Coach Stroke.
Okay, sure.
Some of the benefits that I see of Simulation Lab is it allows you to make mistakes and learn from them. So when you have to deal with it in the real world with a live patient, you'll remember what you did right and what you could have done differently, and you'll bring that forward to taking care of your patients once you get into the hospital.
The Corewell Health Lakeland Simulation Training Center strives to improve patient safety and the delivery of quality healthcare using multiple simulation methodologies. Whether you're a physician, resident, medical student, nurse, or allied team member, we can help you achieve the exceptional patient care you are striving for.